90% of American teenagers take classes on sexually transmitted diseases by the time they graduate from high school. Yet despite this, the U.S. Centers for Disease Control reports that teens between the ages of 15 and 19 have higher rates of sexually transmitted disease than any other age group. One disease that frequently goes undiagnosed is genital herpes. Most infected people are unaware they have the disease. Doctors Anna Wald and Christine Johnston from the University of Washington in Seattle studied 500 people. Some had genital herpes. Others had never had a herpes outbreak, but they had antibodies for genital herpes, which is also called herpes simplex virus 2, or HSV2.
This was the first study to look over time at people that have HSV2 infection but don't have a history of genital herpes. And we really did not know before this how often the virus is active in the genital tract of such persons.
The researchers examined swabs the volunteers took of their genital area daily for 30 days. The goal was to find out how often the virus was active.
Many people think with genital herpes infections that they can only spread the virus when they have symptoms.
What the researchers found out was quite different. For those who had antibodies for genital herpes but did not have a history of the disease, the virus turned out to be active about 10% of the time.
So even people without a clinical history of genital HSV2 are capable of spreading the virus to sexual partners.
The finding has global public health implications. An infected woman can spread the virus to her baby during birth with devastating results. In an infant, the virus can cause blindness. It can infect the brain. It can also affect the baby's central nervous system, causing seizures, meningitis, and death. There is no cure for genital herpes, but medications can suppress it. The World Health Organization reports that 21 million people contract genital herpes each year. That's 21 million people whose disease also makes them 3 times more likely to contract AIDS from an infected partner. Dr. Wald spoke at a recent media briefing in Washington.
There has been several studies suggesting that HSV2 is one of the main drivers of the HIV epidemic in places with high HSV2 prevalence, for example, sub-Saharan Africa.
Dr. Wald is encouraging physicians to advise patients to tell their sex partners if they have antibodies for herpes. She says most new infections come from people who have the antibodies but no symptoms of the herpes virus. She says doctors the world over need to encourage condom use and test sexually active patients for this disease. The report was published in the Journal of the American Medical Association. Carol Pearson, VOA News.
I don't know where we made